Hi, and welcome to my channel, Dr. Coco's Medmonics. Today we're going to be going over the pressure volume loop. And this is the picture that's in first aid, and it's pretty daunting if you're looking at all of these arrows and you're like, okay, I don't know what goes up or down or what I need to know, right? So let's just break it down a little bit and make it easier for our brains to process. So let's look at a blank one. So what do we need to know as far as the normal measurements? So first we need to know the stroke volume, and what are things that we stroke? Well, there's the male symbol, so I think you can figure out from context clues what I'm talking about, but you stroke the entire shaft from left to right, okay? Next we need to know where your systolic and diastolic volumes will go. And the way I remember this is, think about blood pressure. So when you do a blood pressure and it's 120 over 80, you're looking at your systolic over diastolic. So just remembering systolic over diastolic will help you put the systolic on the left and the diastolic on the right. Next, we're going to look at the heart sounds. And honestly, this is a lot already. So let's just cross this out. We're going to shut it down. We're closing these valves, okay? So when you do that, crossing over, this is where your valves will close. So S1 and S2. You're thinking, how am I supposed to remember which one's which, right? So S1 is when you close the mitral valve. And why would you close the mitral? Well, it was open to fill the left ventricle up with fluid. So you would close it when you filled it up with fluid and it's already full. So it makes the most sense that S1 would be at the highest volume on that x-axis, versus S2, when you close the aortic valve, will be at the lowest volume because it's already pushed all of that fluid out and it's ready to close so that it can relax and get filled again. So now you're thinking, okay, what happens during all of these different scenarios, preload, afterload, contractility, and I change them. And the way that I look at this is I just draw the letter. So for increased preload, let's just draw a big P. And when you look at this, I think you can figure out what's going to change, right? So that stroke volume is definitely longer. We definitely have to stroke a little bit longer down that to get all the way to the end. And that would be an increase in your preload. Next, we have increase afterload, and like I said for the last one, we're just going to draw the letter. So here's an A. So if you draw this A right here, we can figure out what's going to change. Your stroke volume's definitely gone down. You have an increase in that aortic pressure, so that y-axis is going to go from maybe 100 to 130. And then you're going to have an increase in your end systolic volume, which we said was point A on this chart. And so then that'll go up from maybe 50 milliliters to 70 milliliters. And so if we draw that A, we know what happens with an increase afterload. Last is increase in contractility. So we're just going to draw a big C. Again, we're going to make this easy. Study smarter, not harder, right? So your stroke volume's definitely longer. It's going to take you longer to go down that shaft. You're going to have a decrease in your end systolic volume, which is that letter A. So you might go from at end of systolic having 50 milliliters to 30 milliliters. And that's it. I hope you enjoyed this video and it helped you. And if it did, please like and subscribe to my channel.